Seth, I'm just testing. Are you getting along all right?
Yep.
All right. We act like we know what we're doing on round 4. I don't know why I'm hungry, but I'm hungry and I haven't done anything all day. I had to go get my famous cookies here. I have a few people that are in both family studies and human growth and development. So you'll notice some people log on and then I'm going to private message them. They have permission to leave so they don't have to listen twice. So
Okay.
that's kind of what's going to happen.
Sounds good.
We'll wait a couple minutes here. Mm-hmm. Alexis? Brianna Hoffman? You may leave the meeting because I know you listened to it this morning.
Okay.
Goodbye.
Hello. Yeah, I guess.
Hi, Whisper. You may also leave the meeting because I had you this morning.
Okay. See ya.
Bye. Thank you for checking in.
Okay.
Alexis Crank,
Yeah.
you may leave the meeting if you want, or if you want to listen again, you may, because I had you this morning.
Okay.
Isabella, you may leave the meeting if you would like, or you may stay on since I had you this morning. Thank you. Okay, Seth, are you good to go?
Yes, I am good to go whenever you guys are ready.
All right, let's go ahead and real quick, I just need to let one person, Zoe, you may go ahead and log off if you want because I had you this morning. Alexis Taylor, you can log off if you want, but you can also stay on because I had you this morning. And Miguel, good morning, afternoon, I guess. And Claude, good afternoon. Janessa, good afternoon. Is Brianna on? I don't think so, is she? Okay. All right, Seth, let's go ahead and get started. And then I will kind of address some issues privately. I think some kids are just now getting on. Yep, there's another one. So everybody, this is Seth, and he is from the Reno County Health Department, and he is going to be talking to you about ACEs today and how that is directly related to some issues that we are seeing today. And he's going to talk to you about some of the effects of COVID. We are very informal, and he likes questions. So he has a partner that's going to assist him, and he is really cute. And maybe later, when it works, he's going to let you meet his partner in crime and anchor, co-anchor. And this is Candace. She is also from the health department, and she is monitoring and sitting in with us. So if everybody would please show your face during the video. So Hannah and Brianna, if you could show us your face, that way we can see all of you. He's going to be asking you to raise your hand and ask some questions. So whatever your comfort zone is, if you could show at least part of you, that would be greatly appreciated. And Seth, thank you again for presenting. Here he is, you guys.
Awesome. Thank you guys for letting me be a part of your day today, me and Candace. I'm going to go ahead and share my screen to get to some slides that we're going to have to help us and guide us through our discussion. And that, guys, is my son who is with me today. So you might be hearing him as we go along. And he tends to want to talk as soon as he hears me talking. So that's what's going on. So as Judy mentioned, we're going to be talking about ACEs, which is adverse childhood experiences, and how that correlates with mental health and also substance use. The objectives are going to be not only to educate ourselves, but it's also to raise awareness to these things and in turn empower us to what we can do about these things and how they affect our communities and our society as a whole. As Judy said, I'm Seth Dewey with the Reno County Health Department. Candace is here with me. I'm a health educator as well as Candace, and I deal predominantly with substance misuse and abuse and how it affects the livelihood and lives of people in Reno County and people in our whole country and the world. All right, so the objective of the presentation that we're going to be doing is to, of course, raise awareness and get a better understanding about ACEs, adverse childhood experiences, and how they really relate to mental health issues and other issues that are facing us in our society. And this is going to help us understand what we as a whole, as a community, are faced with. And once again, that empowerment piece of what we can do about it. So many times we hear about the problems facing us, but many times we are not told about a solution. And so we want to be solution oriented when it comes to things like that, especially when it comes to facing sometimes ourselves and those that we might have daily contact with even. So how many of you guys, go ahead and feel free to raise your hand. How many of you have ever heard about the ACES study or adverse childhood experiences? Have any of you ever heard about those? No? Well, that's cool because that means we're going to get to learn something today. So the adverse childhood experiences study was originally done in 1995 to 1997 by the Centers for Disease Control and the Kaiser Permanente firm. So what they are, ACEs, this study, it was one of the largest investigations ever of childhood abuse or neglect and household challenges and how those affected people, not just in their childhood, but also later on in life, and the habits and the behaviors that they picked up along the way. This was originally done with 17,000 participants in Southern California. So that's a little bit of the background of the demographic. Now, it was done in regards to, like we said, their childhood behaviors or childhood experiences, and then how it affected them throughout their life and their current health statuses and behaviors. So, as we know, this is obviously something that happened to these people in their childhood, but was conducted on them later on in life through this series of surveys and studies. So there are three types of ACEs, okay? Or let's say there's three categories of ACEs. So they can include abuse. And as we know, a lot of times we tend to think of abuse as physical abuse, but it's more than that. There's also emotional abuse and also sexual abuse. Another one of those categories would be neglect. And that could also entail, just like we said with the abuse, that could entail physical neglect and also emotional neglect. Now, the final and largest category of these types of ACEs is the household dysfunction. So that would include what a person might see growing up in their household. So let's say, for instance, in a person's household, if they had a father or a mother or someone living in the household that was incarcerated or struggled with mental illness, or if they ever witnessed any domestic violence within the household, if they saw someone using substances or abusing prescription drugs. And then here's a big one that a lot of times people don't realize because it's so common, and that is divorce. So moving on here, some of the significant, thank you, buddy. Some of the significant findings from ACEs out of those 17,000 participants is that 26% of the people surveyed had at least one adverse childhood experience. And when we think about that, that's understandable, especially when we think about divorce being on there. But notice that 16% of people had 2 ACEs, 9.5 had 3 ACEs, and then it starts to go up again with 4 or more ACEs, being 12.4% of people experienced 4 or more ACEs. If you're curious about the actual questions on the ACE study, you can always Google my ACE score, and you can take that test yourself to give you a little bit of a better understanding of what that test looks like. So this gives us the framework right here for ACEs and what happens if someone has experienced one of these adverse childhood experiences, or what things they might be facing. So I love how this utilizes a pyramid. So as we see, the widest point at the bottom, or the base, is the adverse childhood experiences. Now, once a person experienced something like this or a traumatic event in their childhood, one of the things that closely follows that is social, emotional, and cognitive impairments. So when we think of those three things, let's think about that. Social, so that's how we interact with others. Emotional is how we interact with ourselves and our feelings. And then we have the cognitive, how we deal with these things, how we handle those things, how we talk to ourselves about those, and how we are able to handle these things that we're experiencing. Closely following the social, emotional, and cognitive impairments, we have the chance of adoption of health risk behaviors. What would that look like? Well, dangerous practices, whether that be sexual, promiscuity, or risky sexual behaviors, or the using of substances to change the way we feel. And of course, in that in itself can present the chance of risky behavior or negative health effects, which goes right along with the next step up on that pyramid: disease, injury, and disability. So if we think about all these things and that going upward on that pyramid, we see the ability to handle things. We see the adoption of health risk behaviors, dangerous behaviors. And of course, if we're being risky in our sexual practices or substance abuse practices, it no doubt would increase the chance for injury or disease. And then, of course, the top of the pyramid and the danger of all these things, if it gets to that point, would be early death at the top of that pyramid. This slide here goes into a little bit more of a breakdown. We're going to focus predominantly on two of these areas, but some of those areas that can be affected by the adverse childhood experiences that one might have gone through as a child would be relationship problems, which would entail marital, family, and sexual problems; emotional distress, which we're going to discuss in more depth here in a second, which would entail that depressed mood, panic reactions, or difficulty with expressing anger or ability to control anger. Then we also have actual physical symptoms that can result from ACEs and those experiences, which would include back pain, headaches, joint pain, things like this. And then, of course, what we're going to get into along the lines with the emotional distress as well is the substance abuse, the alcoholism, the smoking, and the illicit drug use. And of course, as this slide shows it, they say what that could affect is worker performance. But if we can just imagine experiencing all these things, not only would it entail or could it result in poor worker performance, it could result in poor school performance, poor dealings with families, just overall hardships in dealing with life in general. So this is going to be a part as we get into this where I'm going to ask you guys a question. So how many of you have ever felt like you are depressed? Have you ever felt those feelings? I know I have. All right. So thanks for for getting involved a little bit there with the raising of the hands. What we're going to discuss here is a little bit of what depression actually looks like and when it becomes something to worry about. So depression can be labeled a feeling of sadness or hopelessness, belief that there's no way to stop feeling stressed out or sad. Some have said that it's a feeling of uncontrollable sadness. I know one that I can relate to personally is the feeling of moodiness or being overly irritable or having feelings of anger and sadness. But this is also where we can also differentiate if it's something normal or if it's something more serious. For instance, if it's something that goes on for weeks at a time, it might be something we need to look into more, because it might be something that's getting more to the clinical side of things. Because it's normal for us to have feelings of sadness when we're going through things or going through certain situations. Other ways that it can manifest itself are eating disturbances or sleep disturbances. And this is one right here, the changes in social life. So if we stop spending time with people that we normally do, our friends, or if we're not answering their phone calls or leaving them unread on Messenger or not responding to their text messages, that might be a sign too that we are experiencing a form of depression. Now, it's not always obvious to us that we are going through a depression. That's why it's important that we take the time to look at things like this, to let us know, oh, well, this might be just more than a feeling of sadness or something like that. This could actually be something a little more. And so it's good to arm ourselves, arm our minds with this kind of knowledge so that we can be more aware and educated in result in this issue. So moving on to the next one, the second part of emotional distress, we have anxiety. How many on here have ever experienced anxiety? I know I have for sure, especially recently. So thank you guys for having a part in that. So anxiety is nothing to be too alarmed about. As this first point brings out, anxiety is that general feeling of apprehension or worry and is a total normal reaction to stressful situations. It's also part of our body and our brain's way of keeping us safe from things. It's that natural inborn defense mechanism that keeps us from a situation if it's dangerous or too uncomfortable for us. But the red flags go up when those feelings start to become excessive, when those thoughts become irrational and start impeding or debilitating our everyday livelihood. Then if that's something that that has bothered us to the point where we might seek out medical attention, that's when that third point comes into play, where it actually might be diagnosed as a disorder. Now, anxiety disorders are characterized by excessive feelings of panic, fear, or irrational discomfort from everyday situations. So, how many of you have ever heard the term social anxiety? Right. I know I have for sure. And that can be something as simple as, getting stressed out or feeling anxious when we're going into a crowded room or into a place where we don't know a lot of people. Or, like for myself, when I'm asked to do a presentation on Zoom rather than in person, because that's totally foreign to me. So I definitely get a little more nervous. But it's definitely one of those things where by arming our minds once again with that knowledge of the difference between normal anxiety when it's becoming too excessive, and then if it's something that's actually impeding the way we deal with our everyday lives. So this is another area where we can see the correlation. All right, so once again, let's think back to our ACE pyramid with that adverse childhood experiences being at the base. If someone's gone through these traumatic events as a child, it only makes sense for us to understand that when someone feels this anxiety or these stresses, that it would be normal for them because they've already gone through other issues previously. So it's not too big of a surprise for us if someone had built up anxiety or is more prone to depression. So it gives us a little bit of understanding on that issue. Now, moving along, we're going to get into the second part of our discussion, which is substance abuse. There's 5 points on here that help us to see what could cause someone to maybe get into trying substances. These are 5 main points that people interviewed said that said these are the reasons that they tried substances in the first place. So that first one, of course, I'm sure you guys have heard it before in some of your other classes, alerting you to the dangers of substance abuse, is sometimes people are just curious about it. Then there's also the fact that there's peer pressure. But then notice those last 3: stress, emotional struggles, and a desire to escape. So when we think of what we just talked about anxiety and depression, do we see a correlation once again? So let's think about that pyramid again. We have the ACEs, those bad experiences, those traumatic experiences. Then we have the depression and the anxiety that can be brought on by those things. And then we have substance abuse. So somebody trying to maybe escape or deal with those things. Sometimes they call it self-medication by trying to escape and deal with those things. Now, a lot of times when we think of substance abuse, or at least myself, I tend to think of just illicit drugs or illegal drugs. I tend to think of the methamphetamines, the heroin, things like that. But in all actuality, any substance can be abused. For instance, there's legal things like prescriptions. If you get a prescription from your doctor to deal with a condition in your treatment, that's definitely something that you're encouraged to do. But it's also something that can still be abused. So prescriptions, depending on the kind, can still cause us to change the way we feel. They can still cause dependence and addiction, even if they're taken as prescribed. So let's think about this. So we're not saying that all prescriptions are bad. Many times people are given prescriptions for anxiety or to help with their depression. And sometimes people are given temporary prescriptions of narcotics. For instance, if they go to the dentist to get a tooth pulled, or if you ever are involved in an accident or things like that, that you have to use to deal with your pain, to manage the pain. But what kind of things put you at higher risk? Well, depending on the types of medication, there's a higher risk of addiction the longer you take them. For instance, the narcotics that you might be given to deal with a broken arm or after a surgery, those types can become addictive even if you are taking them as prescribed. Now, the risk, of course, increases the longer you're on them. And if you also have a family history of addiction or substance use dependency. There's also a danger in the risk of adverse drug reactions if you are taking more than one drug. So or engaging in alcohol, drinking as well. Hopefully, none of you are experiencing any of that. But once again, we know that it's not something that's totally foreign. That's why it's important that we have these conversations. Now, how many of you guys have heard of the opioid epidemic? Okay. So that's something that we've heard within the last few years being coined a lot by the media, just showing the excessive amount of opioid prescriptions we've had in our country, and also, sad to say, since 2017, the large amount of overdoses that we've been having due to opioids. Opioids are a drug that are typically used to manage pain. But the danger with opioids is in the manner that they work on the brain, what they do is they cover over our opioid receptors in our brain, enabling the medication to block us off from feeling a certain amount of pain. But if one takes too many of those types of opioids, it not only will take away the ability to feel pain, it can also hinder our ability to even breathe, resulting in an overdose. So those are some of the kinds of things that we need to keep in mind, even when we're thinking about prescription drugs. This little picture here, the slide, shows us once again the three things that we've been specifically talking about. So we can think back to our ACEs pyramid again. On the bottom here, we have that trauma piece, the abuse, the neglect, the post-traumatic stress syndrome that causes. And then we also have the psychiatric piece, our mood disorders, our ability to deal with anger, anxiety, and things like this. And then leading over to what we just discussed, addiction and substance use issues. And that gets into the chemical and behavioral side of things. Now, as we've discussed, just having one of these things is hard enough to recover from. But let alone when you start to see how those things overlap one another, of course, it's harder to recover from multiple things, especially in the center right there, where you see all three of those overlapping, representing a patient with the most of these things, of course, making recovery harder. Many times, though, when we go through things like this and start looking into it and educating ourselves on this, we can get overwhelmed or fearful, like, oh my goodness, I have experienced some of these things. What does this mean for me personally? Well, one of the things we want to always remind you guys, ACEs and substance misuse are not a destiny. Just because you have a score that might be high, it doesn't mean that you're guaranteed for an early death. The biggest quote I really like from the Kaiser Permanente study is they said, what's predictable is preventable. How so? Well, this gives us an ability to understand how this stress and these traumatic events, it provides us information that allows us to take action and to be empowered with this knowledge so that we can get in front of those things, so to speak, to treat and prevent adverse childhood experiences and the resulting effects of them. The final slide on here is just a little bit of a resource for if you know anyone or yourself that's ever going through a bout of depression or extreme anxiety, or you're feeling like there's no one you can talk to. This is a great resource for us. We can text 741, and you can talk to an anonymous crisis counselor, someone that can just relate to you and walk you through those feelings. You can also call that 1-800-273-TALK or 8255 number as well. So I'm going to open this up to you guys. If you have any questions or any observations through the information that we discussed. Nothing?
Seth, there was a chat in a question about maybe how time in the foster care system could be an ACE. Didn't know if you wanted to kind of touch on that.
For sure. And that's actually something that it's really cool that you brought that up. So time in the system and events that happen in as well. Yes, of course. Because think about this, especially if in the formative years of our childhood, when it talks about the household, it doesn't just mean your parents. It means where you grew up and where you were having those formative years. So, for instance, that could be foster care. That could be an experience that you experienced if you ever had to go to a treatment facility or things like that. That could be in those formative years. Those are just all things like that that can be contributing factors to an ACE score. Does that answer the question? It's important that we discuss these things, because not necessarily just for ourselves, but for those that we come in contact with too. You know, sometimes we might be in a position where we're talking to someone and they reveal some their past experiences, and us having that knowledge can help us to understand where they're coming from and help us to possibly give them information that they can utilize to not feel so alone. Kind of like when we were talking about who's ever experienced depression or who's ever experienced anxiety. It was, if we were the only one that raised our hand, that would no doubt kind of make us feel a little bit more alone. But it's awesome that we're starting to have these kinds of conversations as a society as a whole, because it lets us know that it's more common than we think. And it's important that we have those conversations, no matter how uncomfortable they are at the time. Sometimes the most important conversations that we need to have are the ones that are the most uncomfortable. Does anybody else have anything they would like to ask or to share? Has anybody ever, let me ask this, has anybody ever gone to a doctor or had to go to a dentist or anything like that and get a prescription of opioids or something for the pain? Yeah, that's another common thing. It's interesting because Kansas actually has one of the highest opioid prescription rates in the nation. And Reno County actually has one of the highest prescribing rates in Kansas. So it's something that that it's good for us to be aware of in regards to these kind of things. Sorry, guys. The kid is wanting to share. Colton, come here. Say hi. All right. There's a little man who's trying to share too. So say hi. But yeah, so I just want to thank you guys for letting us take time out of your day to share this information. Hopefully you guys can do some reading yourselves on this. I know that we can only go through so much without overwhelming you with information, especially in regards to something like this, because this is really heavy stuff, especially when you start, if you're honestly looking at it, it can really it can really take a toll, because a lot of times it affects ones that we know, or we've seen it in our own families. That's pretty much all I got. So thank you guys. If you have any questions, please feel free to ask right now. Otherwise, I'm going to turn it over to Judy. Oops, you're muted, Judy. Do I have control over that?
Okay, I think I have it now. Can everybody hear me okay? Give me a thumbs up. Awesome. Thank you, everybody, for participating, and for Seth and Candace for doing a great job. This was our first Zoom meeting ever, and we're going to be back again on another Monday, and we're going to be doing some other topics. So thank you, everybody, for logging on, and you can all leave the meeting, and you want go on and check out my ACES score and learn a little bit on your own about how that all is connected with a lot of issues going on today. So thank you all. Have a good afternoon. Bye-bye.
Bye.